how's the healthcare community specifically responded to telehealth when we think over the last 18 to 20 months?
Yes, that's a great question. I would say that before the pandemic, there was some hesitation around telemedicine and telehealth and whether or not quality of care could be upheld if you were seeing patients predominantly through a digital or virtual media. I think that has been dispelled and proven false many times over. And sometimes it was our own physician colleagues who were the biggest maybe skeptics of virtual care and digital care. Rightly so, they were looking out for their patient's best interests, and we've been taught a lot about laying hands as part of being able to figure out what's going on with patients. But I think what the last 18 months has done for technology is really pull the future forward. So a lot of doctors, even my colleagues that are surgeons, realize like I could actually walk a patient through a CT scan. I can prepare them for surgery. I can talk to them about different diagnoses through the computer and through different vehicles of virtual care, whether that's asynchronous storing forward or synchronous video and phone channels. So now that a lot of people have actually experienced telemedicine on both sides, providers and patients, there's a huge amount of enthusiasm and support behind telemedicine. We now see this as there's so many benefits of telemedicine, from triaging services to being able to take care of our less sick patients via this method, so we can spend more time on inpatient care for patients who might be sicker. I like to say, think about a grandkid who's young and healthy, who needs to touch base with their doctor, and being able to do all of that virtually, which means that their sicker elderly grandparent has more time with the provider in the office and is not exposed to younger people, and then providing care in a safer location. So I think overall, one of the silver linings, if we can use that saying, of the pandemic has been the increased utilization of telemedicine and the increased acceptance of telemedicine as a high quality modality across platforms and across different stakeholders.
Absolutely. That's great. Eric, I think you are here with us now. Are we going to bring him up on the screen?
Here. Hey, Dr. Shepherd, can you hear me?
I can hear you great. We're so glad to have you jump on. I did a short intro of you previously, but now that you're here, I want everyone again to acknowledge your presence as president of global services at Hologic. It's a medical technology company, which really is a global champion in women's health and focusing on the health of women, their families, and their communities. Now, looking at where we're moving forward, which is the title of this panel, Healthcare Access and Options, we were discussing, again, healthcare now and what that response is, in specifically healthcare technology and utilization on a global level. So as president of global services at Hologic, how have you seen, the operations management or the utilization of business and services from a global perspective that has been impacted over the course of the pandemic?
Yeah, thanks, Dr. Shepherd, and I apologize for good old technology here in COVID times. My firewall here at the office in San Diego had locked me out, so happy to be here. Thanks for having us. And I think to your question, when you think of services, when you think about all the medical devices, you have a doctor, a nurse, a technologist treating a patient with a device, screening a patient with a device. On the other end of that is a massive group of customer service, technical support, and field service engineers. Just Hologic alone in the U.S., we have over 500 field service engineers that are considered by our customers as almost part of their staff, keeping them up, keeping the systems running, and avoiding that downtime, which leads to patients being canceled and things like that. So there's so much into that, and then all of a sudden there's lockdowns, right? And we had to adapt in crazy ways, being able to do things more remotely, do things safer, adjust within our system what a certain hospital or imaging center or lab had as far as their COVID protocols for accessing the facilities, because we've got to be there to help. So I think where it really woke us up is the mindset of remote servicing and all the diagnostic technology that exists. And I think some of the barriers to that, I think from an industry study, roughly 80% of the equipment out there has connected diagnostic capability to do things remotely, and maybe 15% of it's actually being utilized. And some of the barriers to that are, a big one is cybersecurity. And for obvious reasons, Colonial Pipeline, et cetera, you can see why there's hesitancy from a hospital or a health system standpoint in terms of working with vendor partners. And really, I think it's going to lead to a whole new wave of collaboration there on what we can do remotely, what we can do to monitor equipment remotely, to fix things predictively, to know some break before it breaks. And I think COVID's been a catalyst to move faster towards that. But it's been, think of service folks, they have absolutely been heroes throughout this pandemic. I think of my service team that I'm so honored to lead, never really left the front lines. And that's going to hospitals and health centers and imaging centers and labs. So important part of this, and lots to do in the future.
No, I appreciate that answer, because what I've heard from both of you and your experiences is that even though we've had kind of this standstill or a surprise of a pandemic, which we haven't seen over a generation, is that you have been called to action in some form of innovation and technology that will not allow patients to be left behind or uncared for. So for both of you to answer, I'll start with you, Dr. Barnes. How was your role specifically in your company taken that leadership role when we think of innovation, technology, and moving forward when we think of healthcare access?
Yeah, so at Roe, we were really committed to making sure that our patients continue to get the care that they needed. Similar to Eric, I would love to, do a shout out to our pharmacists, our pharmacy techs, our customer support team, and our care team, and people who came in and continue to come in day out to make sure that patients get their medications, to make sure that orders are filled on time and correctly. We had no interruption in medication supply chain for patients. They were still getting their medications on time. And for us, that means something like 98% of our patients get their medications within 3 days of going through an online visit. So that's huge to continue to have that stat through the pandemic. Specifically from the chief medical officer position, one of the two things that we wanted to do during the pandemic to leverage technology was, one, we launched the first nationwide COVID telehealth assessment, which was free. As the guidelines from the CDC were ever changing and we were learning more and more about the SARS-CoV-2 virus and COVID-19, we had an online telehealth triage service where anyone could come online, answer questions, and that would triage them into low, medium, high risk. Anyone above a low risk was then connected with a provider to walk them through what to do. And if you can imagine the coordination that it took to do this across all 50 states plus DC, it was a feat. We got it launched in 4 days, starting with the states that were hit most severely and early on, which I believe was California and Washington, and then New York, where we're headquartered, and eventually we were across all 50 states. We then took that technology and partnered with over 50 different companies to do free triage of their employees. And the one that was really, extremely meaningful was our partnership with Uber to make sure that their drivers could go through a triage assessment if they felt unwell or if they had been in contact with a patient at the airport, anything like that. They could go through the triage tool for free. So that's one. And then second was we partnered with New York State to launch the COVID vaccine drive, which allowed us to vaccinate elderly homebound constituents of Westchester County. And that was another, huge effort to combine digital technology, digital product with an in-person touch. And because we have an integrated API through our acquisition of a company called WorkPath, we were able to coordinate all of this. WorkPath allows us to send healthcare professionals into the home and to do a schedule and have a protocol. So I was able to work with my team to write the vaccination protocol, how to give the vaccine, how to assess patients to make sure that the vaccine is safe for them, and then how to coordinate follow-up so they could get that second dose. And that took a lot of work working with community partners, identifying elderly getting translation services. We worked closely with the Office of the Aging in Westchester, as well as Meals on Wheels program, because a lot of our elderly patients, they had access to technology, but they were not necessarily Googling or searching for COVID-19 vaccines. So there was someone else who was looking for vaccination for them, and then they were able to go online and sign up and register for the program. So those are two things. And then lastly, I would say expansion of services. We heard loud and clear that people needed mental health services. It was hard to get in touch with a psychiatrist or a psychologist. And so we are very happy to, announce that we launched our Row mental health vertical called Row Mind. And so we're able to offer mental health services for anxiety and depression. And we're able to train providers and get psychiatrists on board to come and deliver this much needed service during this time of stress, a lot of change management, adjustment disorder. So I'm super happy to have responded to that as well.
Eric, what do you think from a global perspective? As a surgeon, that's something that during the pandemic we were worried about. How is that going to impact our ability to take care of patients in the operating room, making sure that supplies didn't come to a standstill? What type of instances did you see where that could have been an issue? And also, again, the same question posed to Dr. Barnes. How did your company specifically take a leadership role when it came to that?
Yeah, I think the answer is twofold. First of all, I think when Hologic has a very large diagnostics business, and really before pre-vaccine era, if you will, the call was for testing, and we stepped up, and with so many partners and our scientists here, developed two separate assays, a PCR and a TMA COVID assay, where we have now, to date since the pandemic, have shipped over 100 million COVID tests across the globe. And to do that, it was really to see the public and private sectors come together, and the work that the FDA did. Sometimes these things that take years, and the vaccines as well, coming together with a clear focus and a goal. We showed we can act quickly and effectively, and this was on display with kind of unprecedented speed with which we've seen, and we're very, very, very proud of that. And we saw, I think, some great partnership there. To your question, then, to get there, think of those 100 million tests, and you don't think of on the supply chain side and supply chain constraints. So think of tubes, caps, swabs. Being able, even our vendors stepped up in huge ways, where we were able to, partner with them, help make sure they were prioritizing us, make sure we were taking care of them in terms of payment terms and all those things. So much of it goes into it. We have an amazing team on the supply chain side of things. But as a surgeon, when you think about medical devices and kind of where we're at now in the supply chain world, all segments right now of supply chain are impacted by record long raw material lead times, shortage of critical materials, rising, all those things. And just from the automotive example, Toyota cutting 40% of their finished good vehicle production in September due to supply chain constraints. And the same challenges face healthcare. And we expect to see continued disruption through fiscal year, when I look at probably through, midway through 2023, when you look at the high lead times on electronic components and chips and all of these things, all the supplier constraints, logistics, lead times, all of that, it's very real, and it's going to have a continued effect. And I think it's top of mind amongst other things like cybersecurity and other big topics. I think the supply chain issues are very important right now, and we've got to escalate things with our suppliers, looking at purchasing subcomponents. When I think about the service world and the spare parts that we've got to get into these machines to fix them and keep them running, it's a massive labyrinth, if you will, of making sure we have the right parts at the right time. That's same with any medical device provider, whether it's something for surgery or something in the lab or the imaging center. It's a huge focus.
Yeah, I'm so glad you were able to highlight that, because I think sometimes people only see the end product of what's there or what isn't there. And so specifically during the pandemic, even when it came to testing sites or the ability to test patients, obviously at the beginning we had a paucity of having the correct tools that we needed to test people. But again, sometimes the population and communities don't see that. They just see that there's nothing there. But there is such a complexity to getting all the information, to making sure that everything is structured well, even when it comes down to the smallest part of how we test people, how we're able to access people through technology, like you were discussing, Dr. Barnes. There's so much work behind the scenes. So I'm glad that you were both able to highlight the work that goes behind there, and making sure that, again, people are seeing the length of what we do in order to get the specific outcomes that we have.